And I'm definitely familiar with those. So I think it's important to highlight that for parents because you sharing about that sort of testing, like I had no idea. Of course, my son is a little bit of a different case because we're talking about him being on the spectrum. So yes, there have been tests that have been done, but we haven't continued with that. I think it's important to mention that. So thank you for bringing it up. On the same on the same level of the question, I think it goes even deeper when we talk about advocating for our children at school. I also want to embrace encouraging my child to, um, well, to also just accept their unique strengths and talents, regardless of their learning differences. As as a mom of a child who is on the spectrum, a lot of what I hear, as you mentioned, is the self-esteem. um I'm not smart enough. I don't know that. I'm stupid. I'm never going to learn. I'm never going to understand. That's so hard for me as a parent to hear that. It's so painful because as a mom, I want to take away his pain. I want him to view himself the way I view him. So, how can I encourage my child to embrace their uniqueness, their strength, their talents, regardless of anything else that's going on that's different?
Wow, that's, you just touches a very important and a sensitive area, especially, both as a parent, as a child psychiatrist, as a parenting coach, and as a leadership coach. I see the pain of the child, and I also see the pain of the parent. But the most painful is they both are not able to see each other pain. That's the
Mm.
most painful thing that I have been seeing, because child can handle what other people are saying, but when she they are trying to communicate with their parent, and most of the time it comes as an advice, as a suggestion, as a comparison, or you should do this, without realizing where the pain is. If you just keep giving different bandages, no matter that bandage has Mario on it or a princess on it, but if you're not affecting the pain inside of it, not understanding it, it may lead to what you have mentioned. So before I share some specific strategies, one thing I also want to highlight with this psychological testing and neuropsychological testing, because that's another thing I'm seeing very often, because the parents, they are trying their best and they are relying on these experts who do the psychological testing, neuropsychological testing. And many times kids, they have been diagnosed with autism spectrum disorder, but then most of the time everything is just lumped into the diagnosis. No one is seeing this is not describe this child, this is just one aspect of it. Kids who
Mhm.
have autism, they may have a learning disability, they may have an ADHD, they may have an anxiety. Kids who have ADHD, they may have a learning disability, and the vice versa. So that's another thing I have seen, that kids have been struggling. Even parents have been trying to advocate, but somehow the school, somehow the testing results, or somehow, because sometimes let's say they are being tested at age 5 when she or they were struggling with learning. But at
Mhm.
that time, the tests were trying to address mostly the learning, but not the executive functioning, you know. So it's
Mhm.
important, this message for the, the teachers, and message for the school, we need to trust our parents. We need to believe that parents know their child the best. Yes, school is trying their best, but if the child is continuously struggling and parents are bringing some concern, I think it's important to revisit and explore what is missing and what can be done. The second thing, I think that let's to answer your question, how we can bring highlight strength, how we can bring um, the embrace, that strength-based approach to help this child who's struggling the most. I think, so in general, most of the time what I have been seeing, when the child make some mistake or a failure, at that time we are having this conversation where the emotions are higher on both ends. Okay. So if you know that your child has been struggling in some areas, and that your child is really good in arts, really good in speaking, really good in these things, so first create a lot of activities around the child is good at. Because one thing you will be surprised, the sense of mastery can boost your self-esteem and can help and heal those areas that you may not good at. At least as long as you are getting recognized, you are being seen, you are feeling successful, you are being significant in certain areas, then you may get strength to get better in other areas as well. So along with helping your child to get better at math, sorry, I'm bringing math again and again because, this is very common. I have been seeing, at least in my practice. So along with bringing, you also, during summer break, they were so good in skiing, sorry, not skiing, like they were so good in, the different camps and in all those things. During winter, they went there skiing. People were commenting on their art skills and all those things. So you learn about, how I can help my child to grow in that area, so that, there are different ways to approach a vulnerability. One, you definitely address the vulnerability, but the other is you keep honing and making the light, bright side of that child to get bigger. And when you keep bringing that, the dark side automatically become smaller. That's just the simple analogy. But you don't ignore it. Definitely you keep working on it, but the progress may be really slow to it. So in general, have a lot of praise about your child, when he, she, or they are doing well in certain areas. And whenever you want to bring this concern in this one, you always bring, I know that you have been doing so well, you have, and in those areas, and I know these things we have been struggling, and we are here to help and support. Similarly, when you have a parent-teacher conference, unfortunately, sometimes teachers may bring up, or when the child are not doing well or messed up, so you may get that frantic call from the teachers. So you also gently redirect them. What else have you noticed, that you liked about my child? Similarly, when you have 504 an IEP meeting, I have seen this tendency in school that, they bring with the strength. But if they are talking a lot about this, you can say, okay, what do you like about that child? So just gentle redirection, helping everyone see that, yes, my child may have some vulnerability, but he, she, or they may have a lot of strength, and how we can help and support and design our strategies that highlight the strength and supportive and nurturing for the vulnerability area.
Yeah, I love that. And it does evoke a lot of emotion for me as a parent, because it's something that I live every day. And I know that I'm not alone. I know there's so many parents that go through this. And so it prompted the question of, taking care of a child with a learning difference, with a child who's on the spectrum, um, just a child who has a difference period, is extremely emotionally and physically demanding. I am exhausted more often than I'm not. And for me, that's really difficult to see and to feel, because I also see the joy of parenting.